What started as a common diabetes medication has now become the hot celebrity drug for weight loss and has now evolved into a full-scale national trend. The Ozempic craze has ignited fervent debate in the medical community and created shortages of the drug. And new NBC reporting indicates that some independent pharmacies are choosing not to stock the pricey diabetes drug at all. As one pharmacy owner explained, the average wholesale price of Ozempic that pharmacies pay is about $900 for a 30-day supply. But for each prescription, this pharmacist, he was typically reimbursed only $860. The reporting attributed the underpayments to pharmacy benefits managers who act as middlemen between pharmacists and insurers. But beyond the money considerations, there are lingering, very important questions about how Ozempic is being used. Joining me now is MSNBC medical contributor, Dr. Uche Blackstock. Doctor, it's always a pleasure to have you on the show, and it's always good to see you. I gotta ask, what are your thoughts on the use of Ozempic for weight loss? It's an off-label use, and now some independent pharmacies are frankly choosing to opt out of carrying the drug altogether.
Hi, good morning, Katie. Thank you so much for having me. No, Ozempic has become essentially a diet fad. And, I think in our culture that is incredibly obsessed with thinness and weight and that values and glorifies it, we're seeing it being used, as you mentioned, by celebrities, but we're also seeing it being used by the average American that can afford that exorbitant out-of-pocket cost of about $1,000, per month. And what I would say is that there's so much that we don't know yet about using Ozempic for this off-label use and long-term, especially in people who, don't have obesity per se. We even have people that are of average weight that are using Ozempic to lose even more weight. So we also don't know what the short and long-term medical consequences of that are. And we know that people have a lot of different side effects when they take it. About 20% will have nausea, vomiting, diarrhea, as well as constipation.
So how are they getting their hands on something like Ozempic? Are doctors just prescribing it even if it's not actually a part of a diabetes diagnosis?
Yeah, so great question. So one, doctors have a lot of leeway in terms of prescribing medications off-label. So yes, doctors can definitely prescribe Ozempic for someone who is not diabetic at all. So that's one reason. Two, I actually went online, I went on Google, and I found these diet centers that are out there that essentially someone can fill out an online application and get a prescription for Ozempic, without actually being seen in person. So again, these Ozempic prescriptions are being given out like candy by these diet centers and even by some physicians to people who this medication is not medically indicated in.
And so as a result, doctor, the demand for Ozempic, it's now being frustrated for diabetic patients who need this medicine. And due to supply issues, they've had to ration out doses or switch to even more costly alternatives. So what would you advise diabetes patients who are trying to grapple with a shortage?
I know, and I would say even Novo Nordisk, which is the pharmaceutical company that has made it, was shocked at how it's run out. So essentially, they put out an alert a few months ago that they're actually going to be increasing the supply of Ozempic, but we only will see that increase over the next few months. And so definitely people with diabetes are going to have to work very, very closely with their healthcare professionals to make sure that they have access to these medications. We know that independent pharmacies are not stocking it anymore, but larger retail pharmacies are. So they have to stay in constant communication with their healthcare professionals. But I also think that we need to talk to clinicians about, the prescribing off-label of this medication and how it's putting people who actually have a medical condition at their lives essentially at risk by not having access to this medication.
Along the vein of access and money, Eli Lilly saying this week it's going to cut the price for several of their life-saving insulin products. They also touted an existing policy that caps the monthly out-of-pocket price at $35. The New York Times reports, quote, Lilly trumpeted its decision as a victory for patients. In reality, though, Lilly's moves are more limited than they initially appear. So, doctor, walk us through this announcement and what it really means for patients.
So Katie, so people should know insulin is over 100 years old. I mean, as a medication, it was developed 100 years ago, and really it should be available at no to low cost for people with diabetes. But we essentially have three insulin manufacturers, including Eli Lilly, that have a monopoly on insulin. They provide about 90% of the insulin globally and in the United States. So they are able to hike up the prices for insulin. So one, this policy change will impact one of their medications called Lispro, which is a type of insulin short acting, and they're going to reduce the list price of that, but still actually make a good profit. And they're going to put a $35 monthly cap on people who have private insurance. And so, yes, definitely this shows what advocacy and legislative pressure rather, can do in terms of, these insulin manufacturers decreasing their prices, but we need those other two manufacturers, Novo Nordisk and Sanofi, to also reduce their prices as well.